All right. Well, good morning, everyone. It's another fantastic Monday morning here at Healthline Markets. It is November 6th, 9:02. Thank you all for being on the call early this morning on the chilly Central Florida day. And hope you guys are staying warm out there today until it warms up later, I guess. But we are here to improve the lives of our community with affordable healthcare. So thank you for being a part of that mission. Thank you for helping your community and your neighbors. Thank you for every day and helping those that need it most. So with that, we've still got to keep one foot in the classroom and the other one in the field at all times. So we've got a few little things I want to share with you this week just to make sure that we stay sharp and on point. So with that, the training calendar today, United Healthcare is still doing their virtual office sessions. So if you want to jump on there, they'll be available for you at 4 o'clock today. Nothing going on for this short week because it is Veterans Day on Friday. So, things are going to slow down just a little bit. But on Wednesday, we do have our very own Al Clancy will be available for his virtual coffee and chat session. So anything at all that you might need, if you're confused, lost, need some clarification on any subject at all, he is our encyclopedia. So I know that if he doesn't know, he knows the place to find it. So he's going to be available to talk through any ideas, situations, or thoughts that you might have in the business. So he's available every Wednesday at 9:30. So the link is there. Also, Cygnus doing their virtual office session 11 o'clock after that on Wednesday. And Friday is Veterans Day. So I'm not sure if we're going to do our What About Shop session there, but we might move it. So just pay attention to the calendar there. But yeah, Friday we will be closed for Veterans Day. And thank you to all of our veterans. Some of you are veterans agents, and I really appreciate that. We also have Nick Street, who's part of our group, and he is a veteran as well. So thank a veteran this week. It is very important that you do so, because freedom is not free, right? So thank you for your service. Thank you very much for all you've done. So that's the training for the week. Remember, guys, let's keep one foot in the classroom and the other one in the field at all times. So there we go. Moving on, Freedom sent out a message about their new broker services options. So they've added some more options onto their phone tree, and just want to make sure that you guys are aware of that in case you're calling in. And in the chat, I'm going to go ahead and post the Freedom Agent Services line, just in case you don't have it. It is there for you to call. And the Spanish version, in case you want to call in Espanol, is going to be right below that too. That one's in Spanish. So 0539 is in English and 0538 is in Spanish. But you should have got this email, and the email basically shows you the new phone tree. So when you hit option 1, you can check DSNP eligibility and Medicare information. I'm going to talk about that in a minute. Option 2 is to check your certification and ready to sell status. We've been getting some notes from Freedom that there was an additional step to upload your Anthem certificate. So if you've been contacted by the contracting team, please make sure that you get that done as soon as possible. Even though that the certification was already done, we do need to upload it into the Freedom portal. So if you have any questions, you can give us a call or email us at support@. We'll help you out with that. Option 3 is providers, pharmacy, and prescription drug lookup. So they do help you with that in case you are looking for that. I know we've been picking up on our Freedom sales most recently. Plan product and benefit information is option 4. Option 5 is all other Freedom and Optimum inquiries, such as commissions, member status, application status. Those types of things are available. And then option 6 links back to that direct line at Spanish Broker Services. So those are the new options, and they're doing this phone tree because they're getting a high volume of calls. And that comes because they're selling a lot of plans this year. Freedom and Optimum have done a fantastic job creating a great product for 2024. And we are also just remind you that part of the Elevance companies is Simply, which is also a 5-star plan this year. Again, all of them are available on Shop this year, so make sure that you know how to get there and you've got that support there as well. Okay. So going back to the DSNP eligibility and Medicare information, I want to make a note that when you check Medicaid information with one carrier, please make sure that you recheck it if you're going to write them on another carrier. So again, I know we've talked about this in the past, but I don't want to see any applications get jammed up because they have the wrong Medicaid information. So for instance, if you're checking with Freedom for the DSNP information and they give you a certain Medicaid level, if you write them on another plan, let's just say Simply, you're going to need to recheck that Medicaid information because each carrier has a different link back to their Medicaid information. Okay, not all the systems sync the same way with the state. So if you're going to write them with Humana, make sure that you recheck the Medicaid eligibility with Humana in that particular situation. It's really important that you do that. Don't assume just because you checked it with Freedom that it's across the board the same Medicaid level with the carriers, because their systems will cause an issue. Sometimes these systems are updated daily, so it could be one level today and a different level tomorrow. So just make sure that you're just double checking that as well. We do have our very own Angie Karos, who is available to help you with Medicaid verification and applications. So this is the form that we use. Again, I'm going to put this in the chat, but Angie's going to be available to you to help your clients or prospects apply for Medicaid. So very simple form. You just put your name and then which state you're going to be verifying Medicaid for, the client's first and last name, their gender, date of birth. And if you've got their social, that will help a lot because we do need to check some of that information. If you don't have it, it's not necessary. Medicaid ID or Medicaid member ID, if you have it, it's helpful, but not needed. And then Medicare ID number too. So again, if you have it, that's great. If you don't, you don't need it. And then if they are applying for Medicaid, just make sure that you input the phone number and email so we can get a hold of them to help them apply for that particular application. And then if there's any notes that you might need, just go ahead and submit that. Filling this out will take you less than 2 minutes. And then Angie will contact them and help them apply for Medicaid. Okay, so you don't have to get jammed up with Medicaid applications if you come across somebody that is, possibly eligible for some extra help. Okay, that looks good on you because you help them apply for Medicaid, you help them get that service, and it opens up an SEP to join a DSNP product. Okay, so thank you, Angie, for helping us out with that. It is a really great service, and we're getting some great feedback on that. It looks like Scott and Rose here are saying their team uses it all the time. Angie rocks, love it. Thank you very much. Yeah, so we want more people to use this service because we're seeing a great impact, and obviously this is a big help for you as an agent, but also a great service for the community to really help them get some extra help that they might need. Okay. All right, let's talk about some contests. Okay, so Florida Blue rolled out re-enrolled out their new gas card where they're giving you $200 in gas, and it is eligible for those applications written for 12/1, which is this month, and 1/1. Okay, so I'm going to read you the form, but it's live. So if you've written any Florida Blue business, you can go ahead and punch this in and submit this form to your local broker manager. Okay, so I'll read this form for you. Everyone that's contracted with Florida Blue should have gotten this email. I know our contact is Heidi Sierra, so it should come from Heidi. But if you didn't get this, please let us know and we can get you this form. So here it goes. In order to receive the $200 gas card for mileage reimbursement, you must have driven at least 306 miles. And the way that they calculate that is 306 miles times 65.5 cents equals the $200. That's the federal mileage rate for 2023. To and from beneficiary appointments for Medicare Advantage related meetings in 2023. Okay, so if you've driven at least 306 miles, it doesn't have to be just Florida Blue. It could be any Medicare Advantage appointment. You just have to prove at some point, keep that in the back of your mind. You got to prove that you did do those drives. Okay, so this reimbursement is allowed because it's not considered compensation; it's considered reimbursement for mileage. Okay. So that is why they're able to do the $200 gas card. Very generous. So just make sure that you do have some Florida Blue sales, because as soon as you start submitting your sales, then you'll be eligible for this gas card. Okay. So if you have any questions, you can reach out to Florida Blue directly or one of us, and we're happy to handle that for you. Rosie says she uses the form with her Florida Blue business. They do have a W-9 to complete once, but the form each time you sell a Florida Blue. So thank you, Rosie. Appreciate that. So every time you sell a Florida Blue, you can submit this this form for mileage reimbursement, and then they'll just ask you for a W-9. So we have one on file for each of you. If you can't find yours, we're happy to help you out with that. But there it is. So some extra money for you. It's a really great benefit to make sure that you break even a little bit on that. And then also, just want to give you a quick update on the AEP contest. Remember, guys, we are running this for January 1st effectives. We created a quick page for you just to keep track of everything that's going on with the contest. Remember, we need 60 points to get on the cruise. We're going on a Caribbean cruise, 5 days, 6 nights. On May 11th, I think it is. We've got it locked in early May. So if you need those dates or some more information, just please let us know. But here it is. It has most of the information that we have, including the points menu. We've gotten that updated, and then the contest rules again. We are starting to count the points on the board here. Again, these points are preliminary, which means this is not the final points. It means that the point count may go down. And keep in mind that it is important that you know that there could be chargebacks, there could be plan changes. Remember, plan changes don't count, and cancellations, and they must be new to HPM. Okay, so remember that this is where the points lie, and so you can go through that on the sheet there. Any questions or concerns, just give us a call. We're going to try to keep this up to date once a week, so it may not reflect the most updated information here. So if it is missing, or if it's a little off, don't worry about it. We're going to be glad to get that up to date. So there it is. Lastly, before we turn it over to our special guest, we are going to talk about the LEAD program very, very quickly. For the LEAD program, remember, guys, we rolled this out a couple of weeks ago, and we are starting to see some leads come in from all over. And so this is the LEAD program available. These leads are for purchase because we are spending money on generating these leads for you. And we have an incredible system that we put together as far as the training and everything there. So the link to the LEAD program is there also in the chat. So you can check that out. And if you're interested in bumping up your sales and participating in the LEAD program, just remember that we do need multiple states, which include Florida, Georgia, South Carolina, North Carolina, Tennessee, Mississippi, Alabama. But what's great is once you start selling, we will have a reimbursement program for you that could help you offset the cost of those licenses as well. So just keep that in mind. If you're looking to grow, this is another opportunity that you have to keep it rocking. Okay. So with that, I'd like to introduce you to our guest. I'm hoping that James is on the line from Village MD. James, can you hear us?
I can hear you. Good morning, Justin. How are you? Justin, can you hear me?
Audio. Let me make sure. How about that? Can you hear us?
I can hear you guys.
Okay. I'm sorry, guys. I'm not getting audio. Is anyone else getting audio for James?
Can you hear me
Yeah,
now?
I can hear him.
Nick, you can hear me okay?
Yeah, James, I can hear you.
Hold on,
Okay.
guys. Okay, you guys hear him? Great. Okay, I'm just having trouble here, but take it away, James. So sorry. If you want to introduce yourself, and then Nick, if you want to guide him on some questions as well, I appreciate it. I'm going to try to fix my headphones, but take it away, James. Thank you very much.
Yeah, good morning. And sorry for my blurry camera here. It happens sometimes. Hey, and Justin, I think we may have a little tech issue. I don't think that Alfredo and anybody else on my team received the invite from your side. I received it over the weekend. So I'm going to just flip it to them quickly and see if we can get them on the call, if that's okay. Let me just do this quickly here. Okay. Yeah. Hey, well, while we wait for those guys, thanks for allowing us the time here. Nick, I don't know how much conversation you've had with the team, but we're trying to re-engage everybody on the Village MD side, and we were able to find some office locations to do Agent of the Day. I think we have 5 in the Orlando market and 4 in the Tampa market. And Nick, I don't know if you had a chance to see that over the weekend, but we do have locations and times that have already been selected. There's a small process to go through, a couple forms to fill out that agents would have to be approved through Walgreens. That's usually a 24 to 48 hour turnaround time. So if you are interested, and Nick will navigate all this stuff for you, but we were able to make that happen. I know we're a little bit late in the game here, but we figured we would give it a shot. And if there's some folks that want to take an opportunity to get out there and start working with us, and then into OEP and lock-in and so forth, this is just the beginning. And Justin and Nick have been gracious enough to kind of get us together here at the last minute and make some things happen. We've got some good opportunities. We're doing some really cool things within the Village world. And we want to partner with some more brokers out in the marketplace, because you guys are the lifeblood of what happens for our new patients. So any help that we could get, we would really appreciate it. So that's kind of high level. Full disclosure, I'm about 30 days in with the organization. So I'm the VP of Medicare growth. So I'm doing my best to understand all the markets and the VMD locations and the freestanding facilities and so forth. But we've got a great team on our side that know this side of the business and can help you, start to find some more customers out there.
Awesome. Can you hear me okay, James? I've got you now in my ears, so
Yes,
awesome.
I can.
Could you share with the team what areas we could find Village MD? Because I know you guys are now national, and we have some folks that are selling national. So could you give them a good snapshot of where you're at?
Yeah, absolutely. Phoenix is a big market for us. We have, I think, 50 or 60 locations out in Phoenix. We're really a pretty, I don't want to say dominant, but we're a pretty well-known player in the Phoenix market. And then into Texas, all of the major hubs, Houston, Dallas, San Antonio, El Paso, we're kind of all over the place. Houston being a very large market for us. And then obviously Orlando, Tampa, and then the Atlanta market as well. Those are the major hubs that we're really focusing on, where we have our outreach folks that could work with your agents to help, drive membership. But those are the major locations. And then in the Northeast, in New Jersey and New York, is the Summit Medical, which is a little bit of a different animal, but because it's branded Village. It's branded Summit. But in those other locations that I just mentioned, it's all Village MD. And we have locations that are within the vestibule and the attached locations of the Walgreens facilities. And then we have some freestanding ones. And I don't know if any of you have had a chance to go out and see some of these locations, especially in the Village, in the Walgreens locations, but they're really spectacular facilities. So I would encourage you to pop in. We'll get you coordinated with some of our outreach folks and go take a tour. And one of the beauties is, and as I'm learning this side of the business more and more, that relationship that we have with the pharmacist through the back door of Walgreens really makes a big difference, because they don't have to go somewhere else to go do that. And they're kind of escorted out the back door from our facility and kind of cut the line into the Walgreens and pick up their meds. So it's really a really nice coordinated care there between medical and pharmacy. But I highly encourage you to get dialed in and go take a look at some of those locations.
Outstanding. And so you hit on something that I preach a lot to these guys about, lead generation. And we'll talk about your marketing reps in a minute, because I think that is a phenomenal tool that the agents are using right now to grow their business. But the pharmacy, you just hit on something really big. That pharmacist is key. And what James is saying, guys, if you have a relationship with the pharmacist, what ends up happening is seniors and people with Medicare will come in, and they may not be a patient with Village MD yet. They're just going into the Walgreens. You can use that as an opportunity to make that a win-win situation. You can make sure that the pharmacist knows that you can help that person apply for LIS, extra help, which opens up an SEP for you, and they will drive business to you, and you can put that business in Village MD. So it's a trifecta, if you will, just by having that relationship in one place with the pharmacy and the doctor.
Yeah. And Justin, thanks for saying that, because the folks that I've talked to out there, especially brokers in other markets that were getting this launched, once they get in there, because the old days of agent in at X, right? We've all lived through that. But this is really a coordinated effort between our clinical staff, the Walgreens, the manager. Like it's not like, what are you doing here? It's thank God you're in here, right?
Yeah.
And there are instances where we will have, the clinical side is talking to people to go see the person out in the vestibule, the pharmacist, like everybody knows what's going on. And as you know, that's a big plus when you're trying to do a large initiative like this. So, we're looking for this to just run long term. This is not an AEP grab,
Yep.
And especially you've got 3 or 4 5-star plans at least in the Florida market, and we're contracted with them and we work closely with them. So what I'm trying to do in the organization is work with all of those carriers to identify other opportunities to be selling throughout the year, not just in the location, but how do we have this kind of transactional relationship back and forth between Village and broker, that we're both referring folks back and forth.
Exactly. And I think the key to that is making sure that you as an agent are bringing value to the relationship. And one way you can do that is creating that stream to the pharmacist and saying, hey, look, I can help people apply for LIS. I can help them apply for extra help. I can help them apply for Medicaid. Now you become a resource, which again opens up SEPs even outside of a 5-star plan, that you can write D-SNP business year round. And even the C-SNP business is key there too. You're going to see some opportunities with people that have diabetes or COPD or chronic heart disease, and all of those are opportunities. We got somebody that's on. Let me put him on mute. Sorry about that. Okay. Can you talk a little bit about your reps, your marketing reps that are out there that are in charge of growth and work in conjunction with Village MD?
Yeah, and I think Alfredo joined, who's our senior outreach manager from the Orlando market. But just quick overview is we've got folks that are community outreach. That is their job, is to be out in the community. They do a lot of events out across all the markets. It's anywhere that is a quote good location where we've had some success before, but a lot of it is senior housing complexes and other type of community senior events. But their job is to create activity. And right now we have, as an average, half of our events that we're doing are with just us. We don't have brokers there. We want brokers there. And I think conversely is that I think there's events that brokers do throughout the year that, boy, it'd be nice to have Village Medical there kind of supporting their efforts as well. So there are opportunities out there within, I think, both organizations that we could be helping each other. So we've got outreach in all of those markets that I discussed. They've been doing it for quite some time, and they know where the markets are, and they're pretty visible out in the markets. So I think, Justin, as whatever our next steps here is, how do we get some of these folks connected to our outreach teams, and Alfredo and Rula, who's our manager in Tampa, and really start to peel this thing back and see what we could do.
Totally.
Alfredo, are you on?
Yes, I am. Good morning.
Hey, good morning.
Good morning. How are you?
I'm doing very well. Just nice to see you again. And I
Yes, sir.
apologize. I was having a little bit of connection issues here, but finally we got over that hurdle. Happy Monday, I should say, right?
Yeah,
It's
thank
like
you.
years ago, I remember working for a company, got in very early on a Monday, wasn't my best day. And the lady that's cleaning the building looks at me, goes like, "Happy Monday." And I got into the elevator. I'm going like, "Happy Monday." I never heard that before. But since that day, I have learned to say Happy Monday every Monday.
There you go.
Anyway, yes, just to add a little bit to what James was saying, and I'll try to be brief. I know we have very limited time. As you probably already discussed, because I was not connected, Village Medical is currently in the markets of Jacksonville, Orlando, and Tampa. When it comes to outreach coverage, we are actually Orlando and Tampa markets proactively working with outreach. So those are the markets we're developing in the state of Florida right now. My counterpart, Rula, is the senior regional sales manager for the Tampa area. I covered what we call the greater Orlando, which is anywhere from Osceola County going all the way up north to Ocala, Marion County. We stretch on the west towards Davenport, Haines City. And on the east, we go all the way to Altamont Springs, Maitland, and Castleberry, covering everything in the middle. So everything when it comes to Leesburg, Eustis, Mineola, Ocoee, all those cities are covered. So we have outreach. We have I call them the power team. It's a small team right now that we're looking forward to grow, but very focused and passionate about what they do. We'll love to get them engaged with HPM brokers. As we know, we were very engaged last year. Last year is last year, so we're moving now to a new year and a bigger and stronger relationship. And that's what we want. We want to make sure that we're all supporting each other. As James was saying, we definitely want to engage and we believe that the way to grow, and this is very big for us, is being out there in the community, working events, working in senior communities, reaching out to the 65 plus community as well. I'm not sure how much was discussed about what we do and what Village Medical is. I'm sure you heard a lot from James as well, but we have a lot of things that will attract and will be enticing for seniors and for brokers as well to work with us. Are we the best primary healthcare services out there in the United States? You bet we are. And we want to make sure that we grow with you guys, and we're all over the place. Village Medical right now has over 680 locations in the United States. We're in more than 26, 27 markets. And we want to keep on growing. And the way we have grown is trying to make sure that we're catering, and catering to the seniors and making sure that we bring quality of life is what I like to call it. And we have our clinics offer it same day appointments. We have in-home visits. We call it Village at Home for patients that have chronic conditions. We have virtual visits at the clinics. We do diagnostic testing when it comes to blood tests and many other lab services as well. We have extended hours in some of our clinics in the state of Florida. We will continue to keep on opening, having extended hours in many of them. But some of our clinics are opening now 7 a.m. through 7 p.m. on Monday to Friday, on weekends 9 to 5. So that's very convenient for seniors as well, and that's what we want. But going back to outreach, Justin, I think that the most important thing is this: what we're doing right now, connecting and making sure that we can definitely build a relationship. As I said before, HPM with us last year was was a key player, and when we want to go back to that and grow the relationship, and that's why we're here. We have an exciting program this year that we started last year. It was kind of an experiment, but this year it's been reorganized. I'm not sure if Rula is on.
Yeah, I see her there.
Yeah. If she is on, I would love for her to share with you guys a little bit on a limited time that we have, of course, about the vegetable program, broken vegetable program. Rula, you there?
Yes, I am, Alfredo. Good morning. And I'm trying to turn on my camera here. Good morning, everyone, and happy Monday. There we go. You can see me there.
Good morning.
Good morning, Justin. Great to connect with you all again. I appreciate your time. I won't be repetitious in regards to what has already been discussed for Village Medical. We are very much looking forward to working with you. I am now working in the Tampa market. We worked last year together in Orlando, and as Alfredo stated, we are looking forward to this relationship and continuing to grow. Worked with Nick for a while, but this year we are better. We are have set a program in place that we are now introducing in the market during AP for Agent of the Day. You heard a little bit of what is different about us. Yes, we're here and we are growing and will continue to grow. Our Agent of the Day program is implemented for the Tampa and Orlando markets, where we are staffing an agent for 3 hours, 2 days a week in specific clinics. It's important for you to know that in both markets, we have consolidated some clinics. We have a total of 23 in Orlando, 20 in Tampa, and 9 in Jacksonville. At this time, focusing in Tampa and Orlando. A couple of our clinics have been consolidated in Tampa, and I believe we have 1 or 2 in Orlando. We have shared with your group, with Nick and Justin and Sergio, our provider list, which is important for you to have that information. And we have also shared a QR code. That QR code will give you access as an agent to information in regards to NPI numbers, providers, locations, and what plans we accept. We are payer agnostic and excited to work with independent agents as we work currently with 9 different plans. We are staffing agents that are able to write more than 4 plans and working with outreach in our vestibules to educate and engage our community incoming traffic, and that is coming into Walgreens, or also any patients that are curious about us. So if you have not been in one of our Village Medical clinics, I would encourage you to do that. Outreach is very small and mighty in both markets. We will continue to grow. Our outreach at this time is handling entire counties, but they do have relationships with some of you. We'd love to create more relationships with you and invite you to come in for a tour so you can see 3,500 square feet, state-of-the-art clinics, providing blood work, having medications on site. Our AMR communicates in order for our patients to obviously receive their medications, not only in this state, but if they're visiting their friends or family, and having them in the vestibule where we can drive business and engage members for you, patients for us, to provide accessibility. We're in a very competitive market in Florida. I know that's not news to any of you. What is different about us is accessibility. Most Americans live 5 miles from their Walgreens, and our doctors are ready, willing, and able to build a relationship to provide value-based care, but also help the rest of the family. We accept commercial plans. We see patients over 18. Our focus will remain on Medicare and Medicare Advantage, but we are able to see and help the whole family. So the daughter can bring her mother to the doctor and receive the care that she needs. Lastly, I'd like to touch on how can we work together. Alfredo discussed outreach. James discussed outreach. We work in the community. We are out to reach people. We want to partner with you. We want to do events together where we can educate and engage prospects, patients to receive the excellent care they deserve. So working out in the community, working in the vestibule for those specific hours, it is a commitment. We do require some feedback, which you provide via a post-event feedback via email weekly, just so that we can see how you view the vestibule. And our objective is to build a relationship between clinical, outreach, and agent. We were very strong in Orlando last year with HPM, and I appreciate your partnership. I see in the chat that some of you have worked in our clinics. We are looking forward to working with you again and continuing to be a partner. I'm looking forward to welcoming you in Tampa. My clinics go from Spring Hill all the way down to Venice, and I am able to offer some spots that you will be able to staff. And I'm looking forward to having an awesome AAP with you. We'll be happy to answer any questions anyone has.
Thank you, Rula, very much. Two things. What Alfredo had mentioned about the in-home care is very, very unique. There's not a lot of MSOs that have that feature. So guys, keep that in mind if you bump into a member that may need in-home care or they need it now. That's a perfect patient for Village. And then the outreach. I know that James had mentioned, you guys are doing some events and you may not have a broker there. Please call us, even if it's like 911, I need an agent there as soon as possible. We will do our best to get an agent to one of your events. But guys, the key to this is leads, right? And they're going to help you generate leads to grow together. They're not going to walk through your living room, right? You got to go out there, you got to do events. And the top agents that are crushing at this AEP right now are working with providers. They are working with groups like Village MD, and this is your opportunity to get in now, because other brokers are going to get in tight with these guys, and then you're going to be left looking in instead of looking out. So I highly recommend that you connect. I made it very simple. Just shoot Nick an email. It's nstreet@askhpm.com, and he will help coordinate for Village. So we can get you guys in and working with these guys because they're hungry, they're ready to grow just like you are. So thank you, James. Thank you, Alfredo. Thank you, Rula. We really appreciate your time this morning. This is one of many meetings that we'll be doing together. So I appreciate your time.
Sure.
Awesome.
I put my contact information. I'm sure that we all do the same thing on the chat, just in case anybody has any questions. Feel free to contact us at any time. So I got my email and my direct number is there. But it's been great, and we appreciate the opportunity and looking forward to make it happen and grow.
Outstanding.
Yeah, and
thank you.
Tim, you can reach out to Alfredo and Rula, and that's fine. But I would, as far as assigning the offices, I want that to go through me. That way, we can keep track of it, and we don't put two people in the same place at the same time and that kind of stuff. So we can kind of funnel in, funnel out. But if you're interested in any of these spots, and we'll, I think James, I just got an email from you. I got the list.
Perfect. Okay.
So we'll go from there. So if you do have interest in this, please let me know, and I'll coordinate it through Alfredo and Rula on the locations. But then once that starts, and feel free to contact them if you have questions about their clinics, by all means. But
Hey, Justin, if I could just one last thing. One thing that we are very aware of is doing our best at protecting agent of record or agent of referral, let's say. It's not a perfect science, especially if the people don't know they have an agent, but I just wanted to publicly say that is something that we're very, very aware of. And we do our best. Even our folks on the clinical side ask if they were working with an agent. So just so everybody understands, if there's a situation that pops up that didn't happen correctly, is to come through the channels of communication. But we are very in line with the broker community and protecting agent of record for referrals and members. So I just wanted to make sure that we stated that.
Yeah, we appreciate that, James, and that's why you want to have a good relationship too with the outreach folks, as well as the leadership here that's on this call, because they need to know what you're doing. Another good point on why we're using Shop this year to do your apps is because we're able to help you protect that agent of record if you're putting them on the application and on the e-app. We get that information and we're able to lock them in to Village and make sure that we're all on the same page. So please use the systems and they will work, I promise. So with that, thank you guys very, very much for your time. I appreciate everyone staying on the call. And until next time, we'll see you next Monday. Have a fantastic week and happy Veterans Day to you all.
Thanks, guys. Have a good day.